Josh, there was a recent executive brief that was published by Skilled Nursing News, and I think they referenced some of this problem or this challenge that skilled nursing facilities have. In fact, they said that skilled nursing facilities, in order to succeed moving forward, they needed to prioritize not just the care of the patients, but the care and the support of their staff. They said, quote, providers are utilizing technology to create more agile work groups, minimize redundancy, and improve the integration of the frontline staff with other disciplines. I want to ask you, why is supporting your staff so important?
Well, it's huge. I mean, we kind of talked about some of the challenges. One of the challenges we didn't really discuss, but it's out there, and it's a huge part of why people are getting tired in the healthcare industry, is also regulations. Especially when COVID came out, you have all of these government regulations as well, and that's also just another burden. When you have that, you're carrying that on your shoulders and trying to meet those regulations. It's just one other thing that's on your plate. And a lot of those things get kind of roll downhill, right? So they're on the administrators, they're on the directors of nursing, but they're also on the nurses and the CNAs and the therapists and everybody. We're all trying to work together to meet all of these regulations, to communicate to families, to take care of patients and to provide good patient care. And it just becomes such a heavy load, we can't do it all, right? Things are starting to fall off of our backs, and things are falling through the cracks, so to speak. So you have to be creative to be able to try to get through all of these things that you have to do to try to support your staff to help prevent burnout, because you already have all those things and more that people are leaving the field, right? People are like, okay, I'm done. I can go, like, you take a CNA, for example, and they come in and they have to have all these certifications and stuff like that to be able to take care of patients, and they're making, they were making like $14 an hour at the time. They could go into any other, they could go to fast food. My 16-year-old
son makes that at Home Depot now.
Yeah, exactly. Right. You're not going to have to maintain like certifications and things like that. And so you had a lot of people just walking away like, okay, I can support my family and, in another way. So, as an administrator, you really had to find a lot of ways to assist with taking stuff off of people's plate, maintaining these regulations, and trying to communicate with families so that your frontline staff can really do what they want to do, and that's take care of patients the best way that they know how, and still try to meet all these other demands that's on their backs, try to lighten their load a little bit.